Welcome back to What Your GP Doesn't Tell You, the podcast for both doctors and patients with me, Liz Tucker. In this week's episode, I'm talking to the investigative journalist Charles Pillar about a remarkable story of fraud he's uncovered in Alzheimer's disease research, which he discusses in a new book, Doctored Fraud, Arrogance and Tragedy in the Quest to Cure Alzheimer's, published by Icon Books. Charles argues the result of this is that Alzheimer's disease research has been set back years, if not decades. He also discusses the basis on which several Alzheimer's drugs, including Aducanumab, Lecanemab and Donanemab, were approved. Charles says the data is unconvincing and the side effects, including brain swelling and bleeding, concerning. But before we get to Charles's interview, a brief request from me. If you enjoy this podcast and would like to leave a review on Spotify or Apple, that would be much appreciated. It really helps. You can also become a paid supporter of the podcast at patreon.com/whatyourgpdoesn'ttellyu or via PayPal on my website, whatyourgpdoesn'ttellyu.com. A huge amount of work goes into both the research and production of this podcast, so even a small amount of money makes a huge difference. And you can find out more information about the pod on my website, where you can sign up for the podcast mailing list, follow me on Twitter at Liz C. Tucker, and on my Substack account, liz.tucker.substack.com. Many thanks. And now back to Charles's interview. Charles Pillar is an investigative journalist who works for the journal Science. His work has also been published in a number of other publications, including the New York Times and the Los Angeles Times. Charles has won a number of journalism awards for his work and is also the author of the books Gene Wars and the Failsafe Society. Here's his interview. Well, Charles, thank you so much for joining the podcast today.
Thank you for having me, Liz.
Charles, I think to really understand this story, we need to go back to the development of the amyloid hypothesis as an explanation for Alzheimer's. So can you explain exactly what it is?
Sure. Actually, let me go back even further, just for a moment.
Absolutely.
To the genesis of the idea of Alzheimer's disease. So back in 1906, a German scientist, the namesake of the disease, was doing an autopsy of a patient he had treated, and this was a woman who had terrible dementia symptoms. And what he found and identified in her brain were two types of proteins, one called amyloid proteins. These are the sticky plaques that people may have heard of associated with Alzheimer's. And one is called tau proteins, the so-called tangles that are also considered part of the syndrome. And the combination of plaques, tangles, and dementia, that became Alzheimer's disease. Now, for many decades after that, it was considered to be an interesting and potentially important problem, but not one that was given a lot of attention because of simple demographics. That's because back in those days, not that many people lived to the old age that is normally the years of onset for Alzheimer's disease.
So they were dying before they developed it, basically.
Exactly right. Or dying before they developed serious cases of Alzheimer's. And consequently, it wasn't until great developments in medicine, vaccines, antibiotics, treatments for cancer and heart disease, etc., began to really extend lifespans, and particularly, of course, in the developed world. And what we saw was that suddenly there was a big increase in patients who were experiencing dementia late in life. And a lot of money was put into it, particularly in the US, but in other countries as well, including the UK. And a lot of emphasis was placed on Alzheimer's disease in a way that never had been before. And a perfectly logical set of thinking came about. The idea that these amyloid plaques, which were found in the brains of Alzheimer's patients after they died, were the linchpin of this disease, that they caused something that became known as the amyloid hypothesis, which is pretty simple, really, to understand it. It's the idea that the accumulation of these amyloid proteins in the brain kick off a series of biochemical effects that eventually lead to cell death and the symptoms of dementia in patients. That is the amyloid hypothesis. And it became extremely important and popular starting really in the 80s and early 90s. And it was sort of laid out formally in the early 90s by a couple different scientists, including the UK's John Hardy. And they posited that this was the way to understand the disease and the avenue for attacking it and trying to treat or cure the disease.
So this hypothesis has driven a large proportion of Alzheimer's research over the years.
Indeed, it has. Since really the early 90s, it became the dominant way of understanding how the disease operates and how to attack it. And consequently, particularly driven by the massive health budgets in the United States and drug development budgets, there have been many billions of dollars spent on research and drug development associated with this hypothesis. And if I may say that really this resulted in some early, really large disappointments in the field. And that's because a lot of new drugs were developed, and a lot of these were so-called antibody drugs, where they mimic the performance of the normal immune system to attack invaders. And they developed antibodies that would try to take the amyloid plaques and other amyloid proteins out of the brain as a treatment for dementia and as a way of possibly arresting or reversing the symptoms of Alzheimer's disease. And in case after case after case after case, they found disappointing results. They could build drugs that were very effective at flushing these proteins out of the brain, but very ineffective at doing anything helpful for the patients with regard to their dementia symptoms. And also really quite worrisome. A lot of these drugs were hazardous and could even cause death.
And that's because if you're removing these plaques in an Alzheimer's patient, quite often the plaques are attached to parts of the blood vessels. So when you remove them, the risk is that you can cause bleeding and swelling.
That's exactly right. That is one key characteristic. Amyloid proteins do not just float around inside the cerebral spinal fluid that is what bathes the brain, but they also become part of the tiny blood vessels that feed the brain. And during the use of these drugs, they can sometimes disrupt those proteins and cause the bleeding and swelling that you're referring to, that often is not terrible and is tolerated by patients adequately well, but can be very, very serious. And there have been quite a few cases where people have died as a result of that bleeding or swelling.
And it was in 2006 that a paper was published that really appeared to provide fairly definitive backup for this theory.
Sure. It was a very interesting moment in the history of Alzheimer's research because up until the early 2000s, these disappointments that I had mentioned, the lack of efficacy of the drugs, and yet their hazardous qualities, were causing a lot of discouragement in the field. And then a quite clever experiment was done at the University of Minnesota in the United States. And the scientists there, they found that they could isolate a particular type of amyloid protein. This is something called an oligomer variety of the protein. It has to do with the weight of the protein, molecular weight, and it's distinguished from the plaques because this is a protein that kind of floats around and is soluble in the cerebrospinal fluid and isn't just a deposit, a sticky deposit. And they found that if they could take this protein and isolate it from other amyloid proteins, inject it into rats, and they would see that the rats exhibited apparent memory problems that seemed akin to the memory loss that human beings experience in Alzheimer's disease. And so what you had was the first kind of cause and effect relationship between a particular substance and the symptoms of Alzheimer's dementia. Of course, it was in animals and it was a lab experiment, but still it gave great confidence to the field that we are on the right track. We may need some tweaking of our procedures and our identifying the exact right targets of our experiments, but we are headed down the right path. this boosted confidence in the amyloid hypothesis and resulted in billions of dollars in new investment, billions of dollars in new drug development funds, again, all headed in this direction. Now, let me be clear that this was not the only experiment that the amyloid folks felt was positive and conducive to their thinking, but it was an important one. It became one of the most cited scientific studies, basic research studies in the field for many years.
And as you say, finding this helps drive drug development towards this idea of trying to remove plaques. And you touched earlier on some of the problems with those drugs. Now, one of the drugs was produced by a company called Biogen, and they had Aducanumab. Am I close?
That's not bad. That's Aducanumab. It's pretty close.
That aims to remove these plaques. And initially, it seems as if the drug isn't working, but then that data is reanalyzed. Can you explain what happened?
Sure. They had the brilliant idea of looking at the data. First, they decided to end their clinical trials associated with this drug, which was later brand named Aduhelm, easier to say. And what they found was that it wasn't working, and they ended the trials. It's a process that's called for futility. It was unable to have the benefit that they had hoped. And later, they reanalyzed the data and decided that within a certain trial, there was some signs that it might be beneficial. Even though that was one out of two large trials they did, the other one showed no signs of potential benefit. But based on that, they reapplied to the regulator in the US, the Food and Drug Administration, to try to have this approved for use. And there was a big controversy about this that later emerged because it turned out that one of the key regulators within the FDA, a guy by the name of Billy Dunn, was engaging in back-channel conversations with Biogen. And essentially, the FDA and Biogen were working hand in glove to push this drug over the finish line of approval by regulators and sale into the U.S. market.
And is there a documented paper trail for that?
Oh, absolutely. In fact, there was a congressional investigation in the United States that found an enormous amount of impropriety associated with that process and caused considerable outrage among members of the U.S. Congress and extraordinary criticism of the Food and Drug Administration. What eventually happened was that the agency, as they so often do, is they have a meeting of advisors. These are ostensibly independent experts in the field who review the data, review the statements of the company, review the clinical experiments that we're using to test the drug to see if it's safe and effective, and give their views about whether this should be put on the market to treat Alzheimer's patients. And this committee, which had 11 members, 10 voted no, don't put this on the market. It's not safe and effective. 1 abstained. So this was the vote of the advisory committee. The FDA rejected this vote, approved the drug, and allowed it to go to market at the cost of $56,000 per patient per year.
We should say that the data suggested that 4 in 10 patients had brain swelling or bleeding while taking this drug.
Yes.
So you'd mentioned earlier that this could be a minor problem, but that's obviously in this particular case fairly major.
Well, it was fairly common. Not all of these cases were life-threatening.
Sure.
But many of them were serious enough to have the patients be pulled off the drug for fear that their condition might worsen. And in a limited number of cases, it was very dangerous.
And you don't quite know where a brain bleed's going to go. I mean, if I went into my doctor and they said, here you are, Liz, a side effect of this drug is it might cause bleeds to your brain, I think I'd be extremely unlikely to take it unless there was a life-threatening reason.
Exactly right. And as a result, there was a lot of reticence and concern among family members of Alzheimer's patients, among the patients themselves, and of course their doctors in prescribing a drug that had very clear potential dangers and very, very limited efficacy. In fact, basically most doctors, I think, who looked at this carefully would have concluded and did conclude that Aduhelm was a drug that if there were benefits that were statistically measurable as the studies suggested they might be in a certain subset of patients, they were so modest as to be imperceptible to doctors, patients, and family members. So that's not much of a benefit.
Because I think what people often forget is you can have a statistical benefit, but that isn't the same necessarily as a clinical benefit.
Exactly right. And I think it's important for people to understand, well, how do they determine whether there's a benefit? It's based on a variety of tests that have to do with questionnaires and kinds of psychological exams that you give patients. These are not the most reliable way of understanding what's going on with a patient. They're the best we have. And I'm not saying they're useless or terrible, but you have to take them with a little bit of a grain of salt. And the reason is that, as I'm sure listeners who know loved ones who have this disease, that it's a kind of situation where patients have good days and bad days. It depends on their fatigue or what's going on in other aspects of their life. And their performance on these kinds of tests can be variable, even sometimes from hour to hour. And so while the tests are useful and suggestive and can be very important in assessments, we know there's a degree of wiggle room in what they really mean and how they can be used to apply to drug approvals and the mass use of these drugs.
And I think what can be really confusing for people, one of the things that was reported was that patients declined between, I think, 27 to 30% more slowly over 18 months. And that sounds quite impressive. But of course, if that's a very tiny difference, then that may not have an impact on their disease.
Yeah, I think that's a very good point, Liz. And I think what skeptics of the use of this drug have said, and I pointed out that what we're talking about is an 18-point scale. But if you actually look at the difference, again, the idea is not that any symptoms were arrested or reversed. That does not happen with this drug. It has never happened with any Alzheimer's drug. But what we're talking about is the so-called slowing of cognitive decline. They're continuing to get worse over time, but just a little bit more slowly. Now, when you say 27 to 30%, sounds like a lot. But when you look at it on an 18-point scale, it's a minute measure on this 18-point scale. And again, that's why many physicians, patients, and family members would say, there may be something going on there, but we can't even detect it in the behavior or the morale or the sense of self that these patients have.
There's another side effect, Charles, that puzzles me that this drug caused, and that was brain shrinkage, which is puzzling in many ways if it's a treatment for Alzheimer's, as Alzheimer's actually causes brain shrinkage.
It's not just puzzling to you, it's puzzling to the top scientists in the world who have studied this phenomenon. Now, what's really interesting about it is not just Aduhelm, this drug that some listeners may know was eventually taken off the market because it wasn't very safe or effective.
And there was a lot of media coverage about a 75-year-old woman who died while taking it.
That's right. Canadian woman, as a matter of fact, and others had problems as well like that. But subsequent drugs that are very similar, that are a little less dangerous, a little more effective by the standards that were used, basically we have a situation where all of these drugs cause brain shrinkage at a faster rate than the shrinkage caused by Alzheimer's disease itself. Now, what does that mean? We're not exactly sure, but experts in the field disagree on whether we should be worried about it. Advocates of the amyloid hypothesis and of these drugs say, don't worry, it's fine. We don't think this is a big deal. But people who are looking a little bit more skeptically at the performance and use of the drugs and their potential hazards are very concerned that brain shrinkage is a serious issue.
And it's interesting because usually with these drugs, the FDA has been a little bit more gung-ho about approving them than some of the other drug regulators.
That's exactly right. Some of the Europeans in the UK and in other countries at other places in the world, Australians and others, have been reticent about the approval. I'd have to go through the current list of all of the different agencies and their stances, but some have disapproved the use of these drugs in their jurisdictions or have issued extremely strong cautions and have not supported their payment by public sources as a result of the concerns about the drugs. So yes, the FDA and in the United States, Medicare, which is the public funding agency for many, most seniors in the country, their approvals have not been copied necessarily by many of the other public agencies around the world.
The British authority, the MHRA, did approve Lecanemab, which was approved also by the FDA in 2023. But interestingly, the European Drug Agency turned down the approval.
Yeah, I think that shows that, there's been a lot of concern by advocates of the amyloid hypothesis and advocates of these anti-amyloid drugs that are on the market, that criticisms of them are not well-founded, and that criticisms of them are, in a sense, kind of a fringe viewpoint. This is utter nonsense because you have these important regulatory agencies in Europe and in the UK and in other places that have expressed deep concerns about the approval and use of the drugs and have sometimes disapproved their use in their jurisdictions. I just want to make it clear that these concerns are mainstream concerns, regardless of what the advocates of the drugs might say.
Now, with lecanemab, you were actually contacted by an anonymous source who alerted you about a death in the clinical trial for that drug.
Yeah, I was. In fact, a couple of different cases in the clinical trial for that drug, neither of which, I might add, had been publicly disclosed by the company at the time that I was tipped to them by whistleblowers. This initial case, which was pretty horrific, a woman who was brought into an emergency room. She was sitting at dinner with her husband and some friends, and she was brought into an emergency room on what appeared to be an acute stroke. She was given a particular drug that's very commonly given to people who have strokes. It's a clot buster, basically. The idea of it is that it breaks up a clot that's blocking a blood vessel in the brain.
In the same way, if you think you're having a stroke, take a low-dose aspirin in case you have a clot. Same idea.
Yeah, and this is, of course, a more powerful version of that. And this woman, she was given the drug. It's administered intravenously. And she immediately had essentially, it was like her brain exploded. And of course, she was as you mentioned, she was someone who was in the clinical trial for lecanemab at that time. And this woman had enormous brain bleeding and swelling that was apparently caused by lecanemab in relation to the treatment of her stroke. And it was a terrible circumstance in which the woman died under horrific, painful circumstances. This was one of two stories that I broke associated with similar circumstances. There was a woman in Florida who also died under horrific circumstances due to the brain swelling and bleeding associated with this drug. Again, the company acknowledged these problems and these cases only after the stories that I wrote in Science magazine were aired out and the world took a little bit of notice about them.
Now, there's a suggestion that another drug called Donanemab has slightly higher risks of death and brain injury.
Yes, Donanemab is the next of the anti-amyloid drugs that was again approved by the Food and Drug Administration in the US. It goes by the brand name now Kisunla. And again, a little bit easier to say than Donanemab. Kisunla is a drug that showed a tiny bit more favorable statistical benefit than the lecanemab, which is also known as Leqembi. So Kisunla outdid Leqembi a little bit in the statistical benefit. And again, on the grand scale of things, a very, very minute so-called clinical benefit, the perceptible benefit to patients. But it also had a higher hazard ratio. In other words, the relationship between risk and benefit was a little bit worse for donanemab. And as a result, even though it's, again, been approved in the United States, it hasn't been approved by a lot of other global health agencies in other parts of the world.
Now, there's been a suggestion from some people that the problem with these drugs is people have been treating patients whose disease is too advanced, treat them earlier, and the drugs might be more effective or even identify people with potential biomarkers.
Yeah, I think there's a lot of interest in the field in saying, let's find out when these depositions of amyloid protein, again, this is the linchpin of the amyloid hypothesis, find out when those depositions of protein begin to be present in the brain. And there are scans now that are pretty good at that, PET scans in particular, that can detect those proteins. And then begin to treat patients even before they show any symptoms of dementia at all. In other words, let's get these things out of the brain before they can begin the so-called amyloid cascade that leads to dementia. These are pretty edgy kinds of ideas in a way. The reason being that really twofold. One is that you're asking people to take a drug for a condition they don't yet have.
And may never have.
And might never have, because many, many, many people have amyloid proteins in their brain as they grow older and never show any symptoms of cognitive decline. So let me just make it clear. Autopsies have been done on many, many people dying at an old age who had no symptoms of Alzheimer's, no cognitive decline, and yet had heads full of amyloid and tau proteins. So you got to be careful in treating people with a drug that could cause death in extreme cases, and yet for a disease that you don't yet have and may never have. And so the question really becomes, is this an ethical and appropriate way of approaching this problem of going earlier, as you say, in treating the disease? And, there's disputes about whether it makes sense, obviously, in the scientific community, but there's a lot of reservations and concerns about it. That's part one. The other thing I think people need to keep in mind is that inasmuch as the amyloid hypothesis has been and still is the dominant way of looking at the disease, it's by no means the universal way that people look at Alzheimer's disease. Science is vast and scientific ideas are vast. And one of the problems in the field is that the amyloid hypothesis has been, again, so logical, so much stemming from the original discovery and characterization of the disease back in 1906, that its pedigree was so excellent that people felt, well, this must be true. And others, though, have disputed it, and they think that there could be many other reasons why people develop dementia symptoms, not necessarily to the exclusion of amyloid proteins. I have never argued that amyloid proteins have nothing to do with Alzheimer's disease. I think the issue is, do they have everything to do with it? And there are many scientists who dispute this. There are other ideas such as inflammation, perhaps latent viral infections could be causative or influential factors in the disease. There's possible dysregulation of blood sugar in the brain that could have an effect, and other causes as well.
Inevitably, with a drug treatment, you're looking at a single target. And it seems to me there's quite a lot of suggestions now that this is a multifactorial disease. So therefore, by definition, if you have something which is a single target, it's not going to treat the underlying disease.
I think there are many scientists who would agree completely with that statement, Liz. I think it's not impossible that treating one aspect of a disease could have a beneficial effect. But what we've seen over and over again is that the use of these particular class of drugs, the anti-amyloid antibody drugs, if they are having a beneficial effect, it's very small and it comes with risks. And others in the field are arguing, let's look at other aspects of the disease. Let's look at other factors that might contribute. And as you say, try to think of a multifactorial way of looking at it, or perhaps to dislodge another part of the problem that could be influencing Alzheimer's disease to see if we get a beneficial impact for a particular treatment that is separate from the anti-amyloid approach.
What's your view of the research largely happening on the West Coast, where they're using a combination of diet, brain training, hormones, various other supplements, and appear to be getting quite positive results? They've even reported that they've reversed brain shrinkage in some patients. And I've heard anecdotal stories, which I appreciate is not a double-blind trial, from certainly one doctor who went back to work afterwards, who had thought he'd have to give up his practice because of his developing dementia. And just be interested in your perspective on that work.
So let me just say that my view is that human experience is vast and unpredictable, and there can be very exceptional cases that are not well understood. I have not done a really deep dive into all of those methods, but what I can say is that scientists who have done a close look at it, who I trust, have said over and over that the evidence the scientifically verifiable, very closely controlled studies that would need to be done to try to show the efficacy and safety of those approaches have not been done well, and they're not well supported. Let me just say, so that I know of no brain gain, no dietary supplement, no lifestyle change that is an absolute preventive or cure for Alzheimer's disease. But what I do know is that, and this is one of the tragedies, I think, of Alzheimer's, which is that we know a lot of risk factors for the disease: high blood pressure, high cholesterol, diets that are not healthful diets, sedentary lifestyles where people don't get enough exercise. There's many factors that are within our own control as people to influence or change in our lives that are well known to be associated with the onset of dementia.
I mean, it wouldn't surprise me if diet was important, because if you look at other neurological conditions, such as epilepsy, I've had people from Johns Hopkins on the podcast who've also talked about how that work has extended into certain brain cancers and indeed dementia. God forbid, if I developed it, I would think, I've got nothing to lose. I'll see if it makes any difference.
Absolutely. I mean, I think one way of thinking about it is taking precautions to preserve our health and live healthful lifestyles, living our best lives, you might say. That's something that's really beneficial, even if we don't exactly know how beneficial it would be for helping us avoid something like Alzheimer's disease. What we know for sure is that for many people, it can delay the onset of disease if you're unlucky to be someone who eventually suffers from it. And it can also delay the onset of the most severe symptoms. And so, strangely, and I think this is a tragedy, is that, at least in the United States, the vast majority of funds has gone into cures, which is where the money is for drug companies, of course, developing drugs that might attack the disease and arrest or reverse the symptoms, which have yet to be developed. In the meantime, known effective preventive techniques have been starved for funds. Now, they are being funded to some degree, but not as much as they should be.
I guess that's true of all preventative medicine, isn't it, Charles?
It is indeed, I'm afraid. Terrible, but true.
Now, it was in 2021 that for the first time, a researcher alerted you about concerns about possible fraud in lab studies. And there were some peer-reviewed research papers based on those studies, which really were at the heart of the amyloid hypothesis. And the concern was that it looked as if some images in those papers had been manipulated.
Yes. So just to set the stage briefly, I was tipped to some issues in a particular anti-Alzheimer's drug called Simufilum, produced by a small company called Cassava Sciences. And it was getting a lot of attention because they were reporting enormously favorable results. That's kind of a long story. That drug crashed and burned, and some of the people involved in it, one was actually indicted for fraud by the US government, very unusual for scientists to face that. And others were sanctioned by the Securities and Exchange Commission for stock manipulation issues, et cetera. So a strange and sad story. The really interesting thing is that I was looking into that. I got hooked up with a guy by the name of Matthew Schrag, who's a scientist and physician at Vanderbilt University. And he is someone very interested and skillful in understanding integrity issues associated with scientific images. And he had looked into the Simufilum case, and he was honing his skills, you might say, at this kind of process of how do you evaluate these images and understand whether there might have been doctoring of those images in ways that would support the experimental hypothesis of the scientists, but improperly because they didn't really show the information that you were changing them to show. He stumbled across this study that I mentioned before from 2006, published in the exalted journal Nature, which is one of the most important scientific publications in the world.
That's one of the highest impact factors.
Exactly right. When you get a big study in Nature, you know that the world is going to take notice. It's that important. And this was where the study from the University of Minnesota that I mentioned, involving injecting the rats with this particular amyloid protein and seeing them show these cognitive symptoms, that was where it was published. Dr. Schrag at Vanderbilt, he was looking at this, and I'll never forget this moment where he and I were on the phone talking to each other, looking at images together, and we both kind of lapsed into a moment of stunned silence because he had found image doctoring or apparent image doctoring in critical images in that study. This was this influential study that had had an enormous effect on the world of Alzheimer's disease. And we knew at that time that if his findings were validated, that it could have serious ramifications for how people thought about the field. And that was kind of the genesis, you might say, of my interest that led to years of reporting and research for the book.
And what were the images that had been doctored, Charles?
There are two types of images that are central to this kind of research normally. One is something called micrographs, and these are highly magnified images of things like little bits of brain tissue. And this shows you what different structures in the brain look like and what effects of a disease or of a treatment might show in this brain tissue. And these are, of course, samples that are taken either from animals or from deceased patients. The second kind of image that are examined is something called Western blots. And this is a photographic technique that is used to find the types and amounts of specific proteins within a tissue or blood sample. And the reason why this is important is that, as I mentioned before, amyloids are proteins, and tau tangles in the brain, those are proteins. And what scientists are often looking for is what exact type of protein are they seeing in their experiments? Now, these so-called Western blots, they look like a series of stacked bands, kind of little blobs in a way, dark blobs that are like in a ladder-like construction in the image. And using programs like Photoshop, people can change the size or shape of these blobs within the Western blot. They can move them around, erase certain things, or move one band to one place to another. Within a micrograph, these greatly expanded photographs of tissue, they can obscure certain parts of the image. They can clone certain features and move them to a different place or duplicate them in ways that would tend to suggest a bigger effect or a more profound experimental outcome. All of these things are things that Schrag and other so-called image sleuths look at.
So if this is in one of the most influential papers about the amyloid hypothesis, that's going to have a massive impact on the field.
Going to and did have that massive impact. Again, not solely this one paper, but many such papers, eventually I would learn, were also subject to this sort of manipulation.
Let's go into that, Charles. You actually set up a group of imaging analyzing experts to look at many different papers from dozens of Alzheimer's research. In many ways, to me, that's the most extraordinary part of the story. It covers, I think, 571 papers.
Yeah, what we did is, and I'm very grateful to the forensic image experts who participated in doing this work, and that included Dr. Schrag and a woman whose name is Elizabeth Bick, who's also a scientist and perhaps the leading expert in the world in forensic image analysis, a non-scientist by the name of Kevin Patrick, who is simply a guy who really knows how to look at these images using digital tools, and another scientist, Mu Yang at Columbia University, who was also a big participant in this process. Principally, those four looked at dozens of Alzheimer's scientists, including some of the leading figures in the field. This was based on a project that I designed that looked at a large number of scientists and tried to figure out who would be the principal ones to understand their work in order to ask a basic question. Is this situation that we looked at initially with a couple different sets of studies, including the one I mentioned from the University of Minnesota, is this a more general set of problems within the field of Alzheimer's disease? And if so, what is the meaningfulness of understanding the effects of apparently doctored images? And in order to do it, it was a massive project of reporting and scientific examination of these images. As you said, they examined really thousands of studies and came up with about almost 600 that had apparently doctored images or other improper use of images, such as using the same image in two different experiments, supposedly representing two different things. And this is extremely common. In the course of doing this, there were some cases that came up that were really mind-blowing. Let me just mention one, and then I can, if you don't mind, and then I could tell you the bigger global meaning of all this as far as I can tell. One that really, I think, was in some ways the most profound. It involved a scientist by the name of Eliezer Maslia. He's a guy who was an eminent scientist at the University of California in San Diego, California. And this is a very important research center. And he was one of the world's leading experts in both Alzheimer's disease and Parkinson's disease, a neuroscientist with few peers, really, in the world. When you look at the influence of his scientific work, he had published about 800 scientific studies and other papers, and in a wide range of aspects of both Parkinson's and Alzheimer's disease, his papers were in the top echelon of all numbers of papers published and citations to those papers. So that's a way of measuring the influence of a scientist. It's not everything about influence, but it's something important about influence. And this guy was really at the top, near the top in a lot of different categories. And so when the team that I mentioned looked carefully at his papers, and a lot of the work for the Maslia case was done by Mu Yang at Columbia. When they looked carefully at his papers, they found that 132 of those papers were based in whole or in part on apparently doctored images or improperly reused images across studies. And this was pretty stunning. I mean, actually, we don't know for sure how many of his papers overall might have been affected out of the 800, because after about 132 papers found that were problematic, the team kind of threw up their hands and said, okay, we've made our point. And so a 300-page dossier was created that described these problems in exhaustive detail. Initially, when I began this project, I thought, well, this will be an important example to introduce in my book. But I felt that ethically, I couldn't hold it for the book. And the reason was that Maslia had, by this time, some years earlier, been elevated to a job as the director of the Division of Neuroscience at the National Institute on Aging in the United States, which is the premier, largest funder of neuroscience research, including Alzheimer's research, in the world. And as a result, he was one of the most influential directors of the direction of research for Alzheimer's disease and other neurological conditions. And I felt, because the extremity of his problems, of his apparent relationship to image doctoring, as we could see it in these papers, was so important and his influence was so great that I had to go public as soon as I could in an article in Science magazine. And the day the article appeared, the National Institutes of Health, which is the agency that oversees the National Institute on Aging, the day my article appeared, he was no longer in his job. And they said that they had found evidence of misconduct in 2 papers out of the 132 that we documented. So this is a case that really brings it home that this is not just a few isolated people. It's not just people who are incidental to the story of Alzheimer's, but this is someone at the pinnacle, not just of decision-making, but of influence in the field, who essentially had been associated with these doctored images for decades in his career. And it raised profound questions about the way in which the institutions of science were doing their jobs.
It's so extraordinary, and it seems to be so many people involved. Is there any way at all that these could have been genuine mistakes rather than attempts to mislead?
So I would say absolutely. In many cases, they could be mistakes. Look, science is a human process, and scientists, like people in any walk of life, make mistakes. And of course, some of these problems were mistakes. But what we look for is a pattern of so-called mistakes that seem very, very difficult to produce without intentionality. And you can determine this from the kinds and degrees of changes within scientific images that can very easily be demonstrated through forensic analysis. And consequently, when you see, dozens or even more than 100 such cases involving one single person, and you see that they are a pattern of kinds of changes that seem similar to each other over and over and over, you have to ask the question, even if one were to say that many of these things were mistakes, it's a degree of sloppiness and a degree of lack of care that certainly would be unacceptable in any professional field. And so, yes, it's problematic. Now, let me make it clear, if I may, Liz, that like in any walk of life, not every plumber and not every attorney and not every politician and not every journalist is 100% honest. There are people who both in all of those fields make mistakes, and some small percentage cut corners, or they might even transgress into absolute corruption to further their own interests. Science is no different. Of course, there are people like that in science. And I would say the vast majority of scientists, though, are honest and are basically very much trying to advance the field in a way that is consistent with the ethical goals of scientific research.
But you're suggesting this isn't one or two bad apples. This is a process which has involved many people. Surely that is, well, I hope it's unusual.
It's unusual in the grand scale of science, but it's large enough that it could have extremely deleterious effects on the field as a whole. And so, as you mentioned, just to give you some numbers, the scientists and the forensic image analysts who worked on the project with me found these had been cited about 80,000 times in the scientific literature. So what you see is that in certain cases, the 2006 Nature paper about that experiment with rats, that is like a prime example, but there are many like that, where if you inject false information into the scientific knowledge base at critical junctures, you can skew thinking in the field in such a way that it diverts funding, that it changes ideas, that it emphasizes concepts and theories that may not deserve the degree of emphasis that is being given. This is the danger of not effectively policing the scientific literature. And this is the shortfall of the institutional authorities of science to rein this in and to be more vigilant about it. So that's where I think the real tragedy is. A lot of this stuff is preventable. It's possible for the gatekeepers of science, and by that I mean the universities, the scholarly journals, the regulators like the Food and Drug Administration, and the funders like the NIH or others, of course, in Europe and the UK, that have a great responsibility to ensure that the pipeline of information is well regarded because it's authentic and reliable. They have fallen down on the job with complacency and I would say arrogance, unfortunately.
There's a problem, I think, though, with the peer-reviewed model, because basically, if I write a paper, then somebody else who comes into the field may reference my paper, and then somebody after that may reference those two papers, and so it continues. So if that first paper is flawed, it may be referenced in literally hundreds, thousands of other papers.
Yes, not only could it be, but it is. And this is what we definitively found. And what I write about in my book is that because of that kind of chain of events, what you have is you embed false information and skewed thinking into the scientific field that can have a deleterious effect on how people approach Alzheimer's. So, Liz, if I may, I wanted to add one thing that I think is very important to me, and I think important for listeners to understand. In the United States right now, there has been a amazingly sharp backlash by the Trump administration and by RFK Jr., the new Secretary of Health and Human Services here, and others, that has attacked universities, attacked scientific research, slashed budgets, particularly including the National Institutes of Health, which is the funder of most Alzheimer's-related research in this country. I think I've made it pretty clear that I am a critic of the institutional authorities of science. I believe very firmly that they need to up their games. They need to do better at policing the scientific literature, at understanding where the problems are, and doing a better job at thinking about how to solve these problems of authenticity and fraud within science. But I firmly disagree with what the current administration in Washington is doing. I think it's horrifically bad for science, notwithstanding the fact that some officials within the government have even borrowed some of my ideas, I would say in a kind of ham-handed way, in a way that distorts what I'm trying to project here. My goal is to make science better and to insist that the institutions, the funders, the regulators, the gatekeepers of knowledge do their jobs better and enforce quality and integrity and reliability within the system, but not to slash and burn that system. That is not the way to go forward.
But what always seems to be a problem, whenever fraud or problems are discovered, it takes ages for any action to be taken. If this level of problematic data has been found in Alzheimer's research, that has huge implications, doesn't it, for what we think we knew about Alzheimer's and the biology behind it?
I don't think there's any doubt that it has implications for it. I think probably one of the most important things to think about here is the amyloid hypothesis has been dominant in the field. And again, partly because it's logical and partly because it has this pedigree going all the way back to the first characterization of the disease in 1906.
And it's nice and simple as well, isn't it? You've got plaques in the brain, we remove them, you get better.
It's a great thing. It's easy to understand. I would add another metaphor here. Matthew Schrage said, if you go to an emergency room with a knife stuck into you, removing the knife doesn't cure you. And there's a way of thinking about Alzheimer's disease and the plaques in a similar way. Even if they were responsible, it's become increasingly clear that their removal does not cure anyone. And so I think what we have to remember here is that when something becomes dominant that way, reinforced partly by, unfortunately, by doctored research, and reinforced partly by the enthusiasm for this hypothesis promoted by people whose careers and legacies depend on proving it out, and supported by enormous numbers of dollars, billions of dollars in sunk costs that people want a return on their investment for, can become a kind of groupthink in the field that tends to crowd out other ideas or to, reserve the greatest emphasis for one way of thinking. To me, what's encouraging about the field is that this is beginning to break up a bit. Not just, of course, from my book, which has challenged some of these assumptions, but others have also challenged them. I think what the result of it is that certain ideas are getting a little bit more of attention. We mentioned earlier the idea that viruses, latent viral infections, might be associated with dementia, including the herpes virus, which can cause cold sores that then resolve, and people think, okay, I'm done with that. But it's been found that those viruses might hide out in organs, including the brain, for a long time and could cause inflammation or other problems that could lead to dementia. So those ideas are being tested even in clinical experiments now. The GLP-1 inhibitors, like the incredible performance that they've had with weight loss and with diabetes and other signs that they could be very influential in other diseases, they're also thought to be a possible remedy for early dementia of Alzheimer's disease or even possible preventive.
But I would say, certainly in the UK, the way some of the benefits of those drugs have been reported, certainly in some cases, overstated without mentioning they were manufacturer-led trials.
I couldn't agree more. We need to be skeptical of all these things. It would be a big mistake to assume that these alternative ideas had great merit until they're well tested and well supported by independent scientific research. That said, the point I'm trying to make is that there are other ideas for what might be a multi-causal reason for Alzheimer's disease developing. And seeing whether there are other ways of looking at the disease are critical to a better understanding and ultimately arresting or reversing the symptoms of the disease.
Does it worry you, Charles, from what you found out about the reliability of Alzheimer's research, that there might be other issues in medical research? Because why should Alzheimer's be special?
I don't think there's any question that these are the same issues that affect other disease research. In fact, you don't have to take my word for it. It's been well documented that this occurs in research on heart disease, cancer, you name it. There is a difference, though, with Alzheimer's disease, and it's a critical difference. Unlike heart disease, unlike diabetes, unlike cancer research, all of which have been afflicted with similar kinds of image doctoring and outright fraud in the field at probably a similar level as Alzheimer's disease, we have remedies, we have effective treatments for a lot of those problems that there's been enormous advances in all of those areas. And we have not seen that in Alzheimer's disease. We've had decades of disappointment. And consequently, the problem of falsification of research in Alzheimer's is far more tragic in a way than in those other fields.
Now, perhaps unsurprisingly, some people have been very critical of your work. There was a Lancet review by the Alzheimer's research, Dr. John Hardy, who you mentioned in your book, and actually I think you mentioned at the start of our conversation. Can I just quote you something that he writes in the Lancet? Be interested in your reaction. He says, Pillar suggests that much of the fraud in Alzheimer's disease research has been perpetuated on behalf of an arrogant cabal of researchers who support the amyloid hypothesis. As a named member of this cabal, I completely reject this characterization. Indeed, the reason I was attracted to genetic analysis was precisely because it was agnostic to disease cause. My colleagues and I declared our support for the amyloid hypothesis when the first mutations in the amyloid precursor protein were identified as one cause of Alzheimer's disease. And then mutations in the amyloid metabolizing presenilin proteins were identified as another cause. More recently, research has identified the deficiency in amyloid clearance play a large part in the risk of late onset disease. Pillar barely mentions this work in his book.
Well, it's pretty interesting. A lot of the criticisms, including by Dr. Hardy, are what I would call straw man characterizations. In other words, they mischaracterize the arguments I make in the book and then attack their own mischaracterizations. This is an example of it. Nowhere in the book do I say that amyloid proteins should not be studied. And I have always said in interviews and always said in the book that they are part of a complicated puzzle of Alzheimer's disease that scientists are still trying to figure out and put the pieces together. And so I would just say two things with regard to the attacks on me and my book by Hardy and others. One is that most of the attacks that I've seen have been, again, these straw man attacks. It almost is as if the people who are attacking the book have not read it. The second is that a lot of these have been ad hominem attacks on me personally. I just want to say that I have never attacked an individual scientist. I have exposed misconduct often and asked deep questions about the importance of it, but I have never made personal attacks on anyone, and I disapprove of those very vigorously because I think that's not a very respectful way of having a debate. So let me add, if I may, Liz, that there have been really three principal places where criticisms of the book have been aired out. One is the Lancet Neurology editorial that you just quoted from Hardy. One is an article in JAMA, which is the Journal of the American Medical Association. And the third is a series of comments on the website Alz Forum, which I'm quite sure how to characterize it. It's kind of a compendium of information on Alzheimer's disease. It's not journalism. It's more commentary and analysis by people who are interested in Alzheimer's disease. I've been called anti-science even for exposing problems within the field. Myself and also Matthew Schrag, the scientist I mentioned, who was instrumental in uncovering some of the problems of integrity that are described in my book, we offered responses to these comments to Alz Forum, to JAMA, and to Lancet Neurology. And in all cases, they exposed misstatements, outright incorrect fallacies within these comments. And all three of those entities refused to publish our responses. So these are people that are arguing there is no amyloid mafia, there is no cabal of people trying to maintain a certain idea in the field, and yet they don't want to engage in an actual debate or hear any response to their comments, which strikes me as strange. So for readers and listeners who are interested in this, I urge you to go to the website Retraction Watch. Now, this is a journalism website based in the US that wrote a story recently about this controversy about me and my book. And what you can find there is a review of what these concerns were and what Schrag and I, among others, have to say about them, and links to all of the statements being made about the book. Don't take my word for it. What I would urge people to do is look at that article in Retraction Watch, read the links, or better yet, read the book. Read the copious notes that I show that back up the things that I say and the reasons why I think they're authentic, and draw your own conclusions about whether or not those arguments hold water.
And I'll just quote one further point from the review. He says, Pillar emphasizes the rare but serious side effects of these treatments. The risk-benefit relationships of these drugs are being appropriately discussed by regulators and in public fora. A book by a non-expert is not the correct place for these discussions. I sincerely hope that the book and its attendant publicity do not dissuade people who might benefit from an amyloid-lowering drug to decide not to seek help.
Yeah, thank you for reading that, Liz. And let me just say very clearly that the decision of a patient to take an antibody against amyloid proteins is a personal decision that should be made with their family members and their doctor. I do not criticize or object to anyone trying these drugs. It's a personal decision. As I think Dr. Hardy has pointed out, there is a risk-benefit ratio that can be interpreted in different ways. Many people interpret it to mean that these are more hazardous than worthwhile. Others may have a different opinion. There's a lot of sense of desperation among people who have Alzheimer's disease, understandably. And if they want to try something like that may have hazardous effects, that's a personal decision that I certainly have no criticism of. But to blame me, a journalist, for somehow deterring people from trying things that they should be trying, to me is a pretty interestingly foolish way of arguing it. For this reason, the uptake of these drugs has been very slow. And in the well over a year since they were originally approved in the United States, there have been only a few thousand people who have taken the drugs. And the reason for that is that the risk-benefit ratio is not that favorable. And people are smart enough to see that. This was taking place long before my book appeared. I think it shows the sort of really serious kind of self-delusion, I think, that some experts in the field show when they don't look at the big picture of what's happening in the world about these drugs. They don't see that there are many factors associated with people's skepticism. The other thing I think is worth pointing out, Liz, is that I think the argument that trust us, we're the experts, which is essentially what Hardy is saying, is really at the root of what public distrust of expert wisdom has become, particularly in the United States, but globally over the last years and decades, leads to the sort of extreme skepticism of public health and science that I think has been horrifically damaging in the world. It's partly because of the sense of superiority and arrogance that people who say no journalist should be listened to about any of this stuff, it should only be us, the true experts, and yet they're blocking out any debate about the bigger issues. To me, this is very harmful.
Well, I mean, I've had detailed documents about certain drugs and medications, and I've heard statements about them, which I know to be, and these are the documents from the manufacturer. It's not from a pressure group. It's from the manufacturer's own trial, and hearing, I won't name the sources, but very well known media organizations actually just get the facts wrong.
You're absolutely right. It's terrible. And look, journalists are not perfect, just as scientists are not perfect. But I think what we all have to understand is that the scientific community has had a real problem of communications. And this is a long-standing problem of the sense that somehow their expert wisdom is so superior and so important that they have lost the ability to engage in a dialogue and to hear what people are saying and to listen to their concerns in an open-hearted way that can help persuade when necessary and alter the course of events when necessary as well.
I speak to a huge number of different medics, as I'm sure you do. And this is a broad generalization, and there'll be many doctors for whom this isn't true. But very generally, I do find that a lot of doctors tend to underestimate side effects of drugs and maximize benefits. And I think that's partly to do with, certainly in the US and the UK, the level of funding for certain types of tertiary education, which comes from the pharmaceutical industry. Nothing wrong with pharmaceuticals, really important for many diseases. But that is a common pattern I've seen.
No question about it. The enormity of the gravy train for doctors with their hands out to the pharmaceutical industry is very important. In fact, in the book, I talk a lot about the conflicts of interest associated with some leading Alzheimer's researchers who take money from various drug companies to endorse and support their products, even at early stages of development when it's unknown whether these products might have any benefit whatsoever. So I think the problem of that influence is severe. That said, I think many, many doctors are very honorable. Part of the reason they want to prescribe these drugs is that they also feel a sense of a compelling need to help their patients get some relief from this terrible disease. And I'm very sympathetic to that. And I think most of the doctors are quite honorable, but they're human beings. They're affected by who's putting money in their pocket the same as anybody would be.
And the other group, actually, which people tend to think of as disinterested, are the patient groups. But actually, the patient groups often take substantial funding and often are used to lobby for a particular treatment.
For example, in the US, the Alzheimer's Association, which I think has a UK affiliate as well,
Yeah, it does.
was one of the greatest advocates for the anti-amyloid antibodies. And one of the reasons why they lobbied so heavily is that they are well funded by those companies. But to be clear, the majority of their funding comes from individuals and other sources, not from these anti-amyloid companies. So I don't want to exaggerate, but you're still talking about millions of dollars from these companies. So this is a big organization with a lot of facets to their operations. But what I should say about the Alzheimer's Association is that they too feel, I think, a sense of desperation to be able to show that their efforts have somehow resulted in some remedy that can be helpful to patients, because they've been spending, hundreds of millions of dollars for many years with precious little to show for it. And so I think that could be one of the motivating factors behind their incredibly forceful, strong presence in lobbying the Food and Drug Administration and others to approve these anti-amyloid antibodies, despite the meager, if perceptible, benefits.
So for the future, Charles, you said we need to ensure this doesn't happen again, that we have tighter control. But how do we put that into practice?
So there are several things that the institutional authorities of science can do better. So I'm particularly knowledgeable about the United States. I think to a large degree this also applies to other countries, but I'm going to speak for the United States at the moment. The way normally misconduct is examined in the United States, and I'm talking about misconduct that could have a deleterious effect on thinking in the field, that what happens is when an accusation is made, it often will go to the National Institutes of Health, which is usually the funder of this, and they will kick it over to another agency called the Office of Research Integrity, which is another agency of the federal government. And it's a tiny little group that does an initial examination of some of these issues. If they find that some of the concerns are credible, what do? They kick it back to the university where the accused scientist is located. This is really fundamentally critical part of the problem, because these are the institutions with the least to gain and the most to lose by having a robust, rapid, and publicly accessible examination of potential fraud. in the field. And so what happens is these examinations take months or years and often have equivocal or, very unannounced results. Consequently, we never really get to the heart of the problem in many of these cases. We never see any consequences for the accused scientists. And these need to be examinations done by independent agencies. Also, we need these examinations of potential fraud to be done by people who have both knowledge in the field and also knowledge of the forensic analysis that's critical to understanding whether fraud or other kinds of misconduct occurred. The second thing is, I think people should understand that there are some perverse incentives. People are judged often on the quantity rather than the quality of their output as scientists in order to secure grants and get advancement in the field. And because of that, what you see is an incentive for people to cut corners and to engage in activities that might be regarded as improper or even at times fraudulent because they're desperate in a highly competitive situation to produce materials that will advance them in their careers. So these are critical things that need to be done and can be done with a reform of the academic culture. Not easy to do, but it's something that I think in the long run would really help a lot to both increase the quality of research and reduce the kind of bad research that could have bad effects on the field.
Thanks so much, Charles, for talking today. Really fascinating.
Thank you. Those were some great questions. Liz, I really appreciate how you have carefully gone over it.
Thank you.
Thank you so much for your interest, Liz. I've appreciated and enjoyed the conversation. Take care. Bye.
Goodbye. Hope you enjoyed the latest episode of the podcast. And if you've enjoyed the podcast, if you could share it and leave a review on Spotify and Apple, I'd much appreciate it. It really helps. Many thanks for listening. Bye for now.